Is your cholesterol too high? Well, there's two foods that are more research-backed than any other foods for lowering LDL cholesterol. Hi, I'm Dr. Kevin Passero, and in this video, I'm going to share with you what these two foods are, how they work, and why you need to include them in your diet every day if you want to take care of your heart. So the first one is the simple beans and lentils. These humble foods are nutritional powerhouses packed with soluble fiber, plant protein, and lots of resistant starches and difficult, complex to break down carbohydrates. And they work to lower LDL by several different mechanisms. The first one mainly is just all that soluble fiber. That soluble fiber can bind to other cholesterol in your digestive system and help to carry it out of your body. And if it's carried out of your body, it can't get absorbed. Some of it gets absorbed through the food we eat, and some of it gets absorbed through our bile recirculation, which we'll talk about a little bit more in a minute. Now, in addition, the beans and legumes also have a lot of that resistant starch. They have a lot of that complex carbohydrate, and that really helps to balance your insulin levels. And having good balanced insulin levels helps to keep your blood sugar balanced, and blood sugar levels getting too high in insulin resistance is a major contributor to cardiovascular disease and a real strong contributor to inflammation. So beans work in two really important ways. Now, there was a study that was done that was published by the Canadian Journal of Medical Association showing that one serving of beans, which is about a half a cup every day, can lower your LDL by 6%, which is significant and without any side effects. Now, is it red lentils, brown lentils, navy beans, cannellini beans, black beans? It doesn't matter. Basically, a serving of any kind of bean a day will give you that benefit of about a 6% reduction of your LDL. Now, let's talk about oats, the other major powerhouse for cholesterol lowering, probably the most well-researched food for lowering cholesterol because of a very unique type of soluble fiber it contains called beta-glucan. Now, beta-glucan works very, very uniquely in the body to lower LDL through really two interesting mechanisms. One is that beta-glucan binds up your bile acids. That's sort of the main mechanism. And there's two benefits that occur for cholesterol lowering as a result of that. One is that when that bile acid is bound up, it can't get resorbed back through your small intestine. You see, bile acids are hard for your body to make. It requires a lot of energy. So our body has this really elaborate recycling system in our small intestine to resorb it. Now, bile acids contain a lot of LDL cholesterol. So if we just keep putting that bile acid into the small intestine and resorbing it, we're never really getting rid of that LDL cholesterol. Beta-glucan binds the bile acid and carries it out through our digestive system, through our stool, so that we don't resorb that LDL. Now, when the liver senses that bile is not getting resorbed, it has to make more. And in order to do that, it pulls LDL out of circulation in order to make more bile acid, which then lowers your blood levels of LDL. So the beta-glucan really uniquely helps you eliminate cholesterol that's in bile acids, and then forces your body to pull cholesterol out of the bloodstream, particularly LDL, to make more bile acids. So a really neat dual mechanism of action for beta-glucan in lowering cholesterol. Now, you can get about 3 grams of beta-glucan has been shown in multiple clinical studies to lower LDL cholesterol by as much as 10% when consumed regularly. So now we have 10% reduction from beta-glucan and another 6% from beans. We're going on almost a 20% reduction in your LDL levels by including these foods on a regular basis. You can get about 3 grams of beta-glucan from oats in about 1.5 servings per day. And there's nothing wrong with incorporating a half a cup of beans and a serving of 1.5 servings of oats into your diet on a regular basis. Every single patient that I work with in the clinic who adopts these two things on a regular basis dramatically reduces their LDL levels without pharmaceuticals or without supplements or without any other changes. It is incredibly powerful. So if you're interested in looking for new ways to lower your LDL without using other types of interventions and focusing on food, you must consider these two. And lowering LDL is a major part of lowering your heart disease risk, as well as all sorts of other factors related to inflammation and knowing your risks. So knowing your risks is also really important. If you're interested, I have an ebook on the 17 most essential tests for heart health that you can find in the description below, or you can find on my website at www.drkevinpissarro.com. So check that out. Thank you for watching. I hope this information was helpful. If you like it, please like it or share it or make a comment, and I'd be happy to respond. So thank you all so much, and I'll talk to you later.